From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello everyone, I'm Genaye Channel with my co-host, Dr. Lawrence Brent, a rheumatologist with the Einstein Healthcare Network, and this is the Rheumatology Show. Our topic is rheumatoid arthritis. So Dr. Brent, let's get right to the questions that stem from our viewers. What exactly is rheumatoid arthritis?
Well, rheumatoid arthritis is one of the most common diseases we see in our practice. And it's a disease that causes chronic inflammation in the joints, particularly the hands, wrists, and knees. And it's due to an immunologic imbalance that occurs in these patients, often being recognized sometimes months or years before they actually get the joint disease.
And how is this disease diagnosed?
For the most part, patients come into the office often referred by another physician because they're complaining of joint pains, maybe they have some swelling. They might also do certain blood tests that we have certain tests that test for antibodies that are common in rheumatoid arthritis. So that's the most common way that a patient would come to our attention. Sometimes they just come to our office directly and they'll say, you know, I've had this swelling and pain in my hands. And also one of the prominent symptoms is they're very stiff in the morning and they're very tired. Their energy is just sapped. So when we see a patient with arthritis in multiple joints, particularly the hands, wrists, and knees, this morning stiffness and this tiredness, we start thinking of rheumatoid arthritis.
And how is rheumatoid arthritis treated?
Well, when I first started in rheumatology a long time ago, we had like 3 or 4 medications really for rheumatoid arthritis. To be honest with you, none of them really worked that well.
Wow.
I would say since around 2000, there's been an explosion of new, very advanced types of therapies, including some that are given as an injection or as an infusion, that have made a real dramatic difference. So we have this whole new group of tools to use to treat our patients, and we've had much more success. One of the most common medicines we use, which we've been using for about 30 plus years, is called methotrexate. So that's one of the first medicines we'll try, but if that's not working, then we might adjust the dose or start adding other medications to the methotrexate to try to get that inflammation under control.
And who is more prone to developing rheumatoid arthritis?
Well, rheumatoid arthritis is most commonly found in middle age. People say like 30 to 50. Somewhat more common in women than men. But I've seen patients with rheumatoid arthritis who start at a younger age, and there's even like a childhood form, which you call juvenile idiopathic arthritis. It's very similar, but not exactly the same as the adult patients, but it can start really before even age 2. So children can be affected by a similar type of disease. And of course, we do see it occurring in people in their 70s and 80s for the first time.
Dr. Brent, what kinds of success have you had with the new medications treating this disease?
Again, I've been a rheumatologist for 30 years, so when I first started in practice, it was not uncommon to see a patient with really severe deformities of the hands, where as soon as they walk in the office, you could tell, like, oh, that's probably rheumatoid arthritis. And we were sending these patients to hand surgeons, to spine surgeons for knee replacements, for hip replacements, very, very frequently. In especially the last 15 years, the treatment has really given us the ability to stop the disease from progressing. So especially if we get a patient very early and get them on treatment, they'll come in, I'll examine their hands, and I can't see any evidence that they've ever had rheumatoid arthritis. And they don't go for surgery as much as they used to. They don't use the canes and the walkers like they used to. So these treatments have really had a major impact on the disease.
Well, thank you so much for sharing this great information.
Thanks for having me. My pleasure.
You're welcome. Be sure to watch more episodes on this topic and other issues of interest to all patients here on the Rheumatology Show. We will see you next time.